Greetings, I'm Dr. Shreyas Pradeep. I'm a consultant ENT surgeon. I'm working here at Meenakshi ENT Specialty Center. We have two centers, one in Baswangudi and one in Banshankari. I take care of the Baswangudi center, and most of my surgeries happen in the Banshankari center. I did my undergraduation from JJ Medical College, Davangere, which is one of the premier institutes and one of the old medical colleges of Karnataka, and did my post graduation from Devarajaris Medical College at Kolar. So, MENS is a one stop ENT solution for all ENT problems. We have established in the year 1997. It was started by Dr. P.S. Pradeep Kumar at our Baswangudi Center, and slowly in phases we have expanded to the present place, which can now house about 29 patients. We are 29 bedded hospital, and we offer all ENT services at one place. So starting from an allergy clinic which we run to treat and diagnose and treat our allergy patients, we have OPD units where we examine patients, and we are having microscopes which are we have an allergy clinic where we diagnose and evaluate allergy, and once the patient has been found to be allergic to a particular item, so we suggest to them how to go about the treatment. We also provide immunotherapy for people suffering from allergies for a very long time after detection of the allergen. So this is like vaccination for their allergy problem. So we have a full-fledged sleep clinic. This is for people with snoring disorders and sleep-related issues. So people are evaluated here for their snoring problem, and we assess the severity of their snoring. And once we have a good score for them, we go ahead with the treatment of snoring. Some people require certain devices like CPAP, and for some people we also suggest surgeries which can help cure their soaring issues. We have a full-fledged audio vestibular lab, so any patients with problems in hearing are evaluated with hearing, and also people with vertigo. Vertigo is a very common issue today, and vertigo can be because of many issues. So we actually evaluate inside the ear as to what is the reason for their vertigo, and we go about in the management of these conditions. So we have a full-fledged lab which actually caters to diagnosing different areas as to from where the different in from which different area is the vertigo originating, and based on that we are able to come up with a diagnosis and a specific treatment for their problem. We also run a full-fledged speech and swallow clinic. It is a very essential part of our of an ENT surgeon. So any patient with maybe a stuttering disorder or a stammering disorder, people having cochlear implants who require rehabilitation for their hearing, people with speech related issues are all advised to get a diagnostic evaluation done first at the speech clinic, and later we have a therapist who's here who will help them recover from their speech related issue. We also run a full-fledged swallow clinic. This is specially intended for patients with swallowing disorders. So patients maybe after a neurological disorder, if somebody has had a stroke and has having difficulty, if somebody has gone through a neurosurgery, they might get their actual tumor removed, but following that they may have swallowing difficulties which may still persist. For such individuals, we actually do a diagnostic endoscopy. We find out which area is affected in them, and we provide swallowing rehabilitation for such patients. We have also introduced something called as vital stim therapy. This is a kind of a physiotherapy for patients with swallowing disorders of neurological origin. So patients who have a neurological disorder and require a physiotherapy will be given some amount of electrical stimulation using vital stim therapy, and this will help them recover from their swallowing problem faster. We also run a full-fledged cochlear implant clinic. A cochlear implant is basically a device which we introduce in generally a child, basically with anybody with a profound hearing loss and who's not getting benefited with a hearing aid. And when we introduce this device, the patient is able to hear again using the device. So this is introduced following a surgery. So we have a full-fledged therapy which we need to provide to such patients following their cochlear implant surgery. For this, we have a setup. So since it is mostly children who are the sufferers and the people who are going to be using the cochlear implant, we run a clinic which can help them rehabilitate and help them recover from this issue and develop their speech so that they get integrated into their mainstream and not be termed as disabled anymore, not be termed as hearing disabled or hearing impaired anymore. So they don't have to suffer from any sort of a disability and get integrated to the mainstream. For this, we are also having a state scheme as well, a Karnataka state scheme as well as the national scheme, where we provide free cochlear implant devices to such patients, to eligible candidates. So one of the common questions I get asked always is, I have a deviated nasal septum, do I require a surgery for this? So as a fact, if we actually see many people on the road and we actually look into their noses, many people may have a deviated nasal septum. In fact, more than 80 to 90% of the population has a deviated nasal septum, and everybody does not require a surgery. But there are a lot of people in whom this deviated nasal septum can be a significant issue. People may be having difficulty in breathing, they may be having difficulty in sleeping, they may be having allergy issues which could be getting aggravated by a deviated nasal septum. If such is the case, yes, surgery may be an option for such patients, but everybody having a deviated nasal septum does not require a surgery. A lot of my patients ask if snoring is actually a good thing. So is somebody sleeping in bliss when they're actually having snoring? But the fact is actually no. So snoring is not something which is normal. It can be okay to snore. Mild amount of snoring is still okay. But snoring could be actually leading or pointing us to something greater than just a good sleep. So many people who are having snoring issues could also be suffering from something called as obstructive sleep apnea syndrome. So obstructive sleep apnea is basically a blockage in the air passage anywhere from the nose till your chest. So any obstruction from this passage anywhere from the nose till your chest, if there is an obstruction, this could lead to snoring. And this snoring also reduces the amount of oxygen which we are able to breathe. So if we are getting less oxygen, it is actually putting stress on our heart, it's putting stress on our brains. So we actually physically are sleeping, but we are actually getting less oxygen, which is in turn making our heart work more, making our brain not get enough rest during the sleep. So we are prone to heart ailments, we are prone to cerebrovascular accident, a stroke. So certain rhythmic changes in the heart, apart from lack of concentration and daytime sleepiness, and so many other issues which anybody could be suffering from during the sleep in the daytime or subsequently in the morning due to the interrupted sleep in the previous night. So this snoring is something I intend you do not neglect. This is something which can be addressed. We normally evaluate people who are snoring by doing a sleep endoscopy and also evaluating them in the sleep lab. Following this, we can also suggest if they are an ideal candidate for a device called as CPAP, or some people may also require a surgical intervention for curing of their snoring issues. So one of the other common questions we get asked, or many people in fact very vaguely use the term sinusitis. Sinusitis, I'm sure every kid in every village of India already knows about it. So people loosely use this word. Actually, sinuses are empty spaces inside anybody's face. It is there to make the face lighter. But being empty cavities due to issues in the nose, some people may develop a problem, may develop inflammation inside this. This is called sinusitis. So patients who are actually suffering from sinusitis may suffer from maybe discharging nose, a nasal blockage. So running nose can be faced. Some patients complain of facial pains, headache, or heaviness in the head on bending forward. So these are certain common things patients complain of. And if something like this is actually being faced by a patient, we normally ask them to initially take some amount of home remedies, maybe use some nasal decongestants for a while. Patients use tablets like cetirizine or anything to reduce the amount of nasal secretions. Some patients also tend to have allergy issues which could be leading them to sinusitis. So allergy prone patients generally are already using nasal sprays, tablets from time to time, which will help them relieve from sinusitis. So this on a general basis people can note, but in case their sinusitis is established and their medical or home-based remedies do not work, then I urge you to come and visit a ENT surgeon. So sinusitis is a very large issue, and chronic rhinosinusitis is one of the very common conditions prevailing in our society. So many people having such sinusitis need further evaluation in terms of a scan, in terms of nasal endoscopy, or maybe a blood test which will tell us what exactly is keeping their sinusitis as a long-term problem. And such patients, after evaluation, appropriate remedial measures will also be suggested to them. So voice is something which is very unique to every person. Voice is normally produced by two vibrating structures. These are called the vocal cords. Vocal cords are situated in this area, much away from the tonsils, which normally people think is due to is the reason for their change in the voice. So vocal cords produce the vocal cord is the sound producing area inside the throat, and this is what will actually give rise to the unique person's voice. And many a times excessive usage of your voice can actually impact the vocal cord. People who are in the habit of shouting, maybe teachers, singers, or professional voice users, tend to strain their voice box more, and the abnormal vibrations in these people or excessive vibration in these people can actually alter their voice, and when this is happening over a long time can also lead to disorders in the voice. So you might have heard a singer's nodule, teacher's nodule. So these are certain small bumps which can appear on the voice box and can permanently alter the voice of a patient. So proper vocal hygiene for especially professional voice users is very important. Not to strain the voice too much, give adequate amount of rest. Especially today, everybody is working and having to make calls, continuously speaking for hours together on video calls or having Zoom meets. So during all these episodes, when you're speaking, please take breaks. Not to continuously speak for more than 45 minutes at a stretch before you have to speak another. Pause for some time, maybe take some breaks in between, drink some water. All these things will actually help. Also giving a good amount of rest in between, maybe take a 10 minutes break also, that will also help in giving a good amount of rest for your voice box. What you eat will also significantly impact your voice, because if the acid which is produced in the stomach is coming up, so which is called as acid reflux, it can impact the voice box. So acids which is refluxing up can actually produce a swelling in the level of the voice box, and this swelling, when lasting for a long time and when coupled with voice abuse, can actually cause voice related issues. Anybody suffering from a voice change for more than a week, it is abnormal. So it is necessary for you to meet an ENT surgeon, and when you come here to us, we will actually examine your voice box. We have devices, we have cameras which can actually look into your voice box. We are able to see if there is any problem in the voice box. We are able to assess your voice using a computerized analysis, and if there is any alteration, we can actually from the normal, that is, we can actually check what is the problem which is giving rise to the change in voice, and are able to appropriately guide you as to how to go about it. For people requiring long-term treatment, we also suggest voice therapy, which is provided by a speech and language pathologist. Medical emergencies are very common. We may have times when you suddenly may have insect crawling up into your ear. You may be doing something, suddenly you have accidentally poked a earbud into the ear canal, damaged your eardrum. Your nose may suddenly start bleeding. We have children suddenly inserting foreign objects into, especially coins. So people swallow coins and it gets stuck in the throat. And we have elderly people who are maybe eating something and their dentures suddenly get stuck in the throat. In all these conditions, your head goes blank, you don't know what to do. So this is the time we need to look up to a healthcare company, and one such company is Medi-Talks, which will come to your service immediately at the time of need. They provide a 360-degree care right from picking up the patient or anybody in need from your doorstep till taking the patient to the hospital and showing it to the concerned doctor. So this service is being provided by Medi-Talks in Bangalore for a very nominal this thing, and the ambulance services are provided free of cost for the patient. So any medical emergency, just remember Medi-Talks.